Nigeria, welcome to another episode of the Voices for Self-Care, where we advocate for moving national policies for self-care from policy to practice. If you're just joining us, a warm welcome. Now today we're going to be talking about a very important aspect of translating self-care policies into measurable action, because self-care interventions cannot be measured without proper data management. And that is why today we'll be talking about from policy to practice through numbers, data management for self-care. We'll go on a short break right now, and when we come back, I'll let you know the very important guest who will be taking on the discussion with me. Stay tuned. Welcome back. This is the Voices for Self-Care, the #1 show advocating for self-care in Nigeria. On this show, we highlight the efforts of partners working to move policies for self-care from just policies into practice. And today, we're talking on the topic from policy to practice through numbers, data management for self-care. And to take on this important discussion with me is a very important guest. Our guest today is a monitoring, evaluation, research and learning specialist with over 2 decades of experience in designing, conducting and leading evaluations in public health, maternal, newborn and child health, integrated reproductive health and governance, social services and sustainable development sectors. He has expertise in logistics management, information systems, maternal and child health programs, and stakeholder management. He has played key roles in data collection, analysis, and reporting for maternal, newborn, and nutrition programs in Nigeria, and in studies on scaling up post-abortion care. He has developed performance monitoring plans for projects in Nigeria, Liberia, and Ghana, and is recognized for his use of participatory approaches. He has authored a number of publications, technical reports, and presentations demonstrating strong communication skills and ability to disseminate research and evaluation findings to diverse audiences. He holds advanced degrees in epidemiology, and community health and development studies. Ladies and gentlemen, please join me in welcoming the phenomenal Dr. Gbenga Ishola to the show.
Thank you very much, Harry.
It's such a pleasure to have you.
It's my pleasure to be part of this discussion session. I hope it's going to be very interactive.
It's going to be very interactive. I'm so happy to have you here, and I look forward to the exciting conversations we're going to have. Yes, because of course we're talking about data management for self-care from policy to practice through numbers. We have on the show, we have spoken about, we've highlighted the efforts of other partners in service delivery, demand generation, and now we're talking about data management, because I mean, we can do a lot of implementation, but if we cannot measure it, then there's really no point. So that's why I had to get you on the show today, and I'm so happy to have you here. Thank you. Okay, so the first question I'm going to ask you is, so since 2021, when the National Self-Care Guidelines was developed, when it was launched rather, Nigeria has taken the lead in advancing self-care for SRMH. Now, could you tell us the active role that your organization GSI has played in advancing self-care nationally and subnationally?
Thank you very much for that question. Apparently, when you look at the development of the national guideline, one important thing that counts positively for it is the fact that it was done jointly and participatory. So no organization, including the Federal Ministry of Health, can boast that, okay, I'm responsible for this deliverable. But like you said, I want to actually let you know that JSI as an organization has been a very good contributor, both technically as well as financially, for the development of the national guideline, as well as in the implementation. One active thing that was done through GSI support was the constitution of the National Coordination Committee, as well as the Advocacy Committee, that can actually make sure that work plans are developed and implementation of the activities in the work plan as well undertaken. Importantly, there are specific activities that GSI actually undertook. One of those is the issue of participation and leading the development of the monitor and evaluation plan for GSI for self-care implementation in Nigeria.
Okay, thank you very much, Dr. Gbenga, for that insight. So I'm going to talk to you about data management, let's just delve into it. How important is data management when it comes to self-care implementation in Nigeria? Why is it so important?
Okay, when you talk about data and data management, data is just like figures. It's figures 1, 2, 3, 4, 5. Those are data.
Okay.
And importantly, they comes in form of figures. They might also come in form of words. That is when you have descriptive data, qualitative data. And importantly, in program management, if it is not in written form, it is not done. That is one of the biases of MIE especially, that you might be able to have done a lot of work, but if you are not documenting them, either using data or narration, you have not done anything, because there are no evidence to demonstrate to show that you've been able to do this.
Yeah.
So before we can talk about data management, it's broad. Data management is broad, it's all involving of a lot of things. It starts from the process of actually deciding what type of data do I want to collect. Then you go to this, how do I want to collect this data? Then how do I want to collect the data before the analysis? So these are components of data management. You cannot actually analyze without collecting, without collating, then analyzing and reporting. So data management is very strategic to the implementation of self-care in Nigeria. If it is not done, there's no way we can demonstrate through evidence to the outside world and to the stakeholders that we've been able to do this.
Yes.
Remember, like I said, it can be quantitative, it can be qualitative.
Yes, yeah. Thank you very much, Dr. Gbenga. Let's talk about the monitoring and evaluation framework. The first question I have to ask you is, the monitoring and evaluation framework the same thing as a monitoring and evaluation plan, M&E plan? Is it the same?
No.
Okay.
The MIE plan, let me take it this way. Monitoring and evaluation framework is a component of MIE plan.
Okay.
So the MIE plan is very broad and it has a lot of components, out of which MIE framework is part of it. MIE framework is just like a dramatic description of what you're going to be doing and how it will lead to you to achieve a desired goal.
Okay.
Like it comes with critical assumptions that if these things are available, we'll be able to actually achieve the desired goals.
Okay.
Remember, if these things are available.
If like those variables, are in place, okay.
The MIE framework comes with the question if.
If, okay.
We will only be able to achieve this if we are able to meet this objective, if we are able to do these activities, it will lead us to achieve the desired goals and objective, to make a change. So if those things are not there, the probability is more than half that you might not be able to actually achieve the desired goal. And the MIE plan itself, is, like I said, is very broad. It talks about the strategy for which you are going to be collecting your data. It talks about your indicators and how you're going to be tracking the indicators. It also talks about responsibilities, roles and responsibility. Who will be involved in the process of data collection? Who will be involved in the process of supervision? And to a greater extent, if there are issues relating to lesson learned in terms of learning agenda, you want to actually conceptualize your learning agenda right inside your MIE plan. So you can see the difference between the two. MIE plan is very broad, and the MIE framework is a component of the MIE plan. Yeah.
This is really clear. So could you walk us through the process of how it was developed?
Okay. Technically, nobody, as an MIE especially, I cannot lay claim to the fact that I developed this MIE plan.
Okay.
Because it will be wrong of me, and I will not be able to actually make sense out of what the technical people want to achieve. So the best way to actually develop an MIE plan is to use a participatory approach.
Okay.
So like I always tell people, if you want me to do a good MIE thing for you, let me be involved in the process of your activity. So it was done jointly with all the program officers in place, and it provided the opportunity to be able to ask them questions. Why, and this is what we can do. So it was done using participatory approach at different level. It started with stakeholders holding a meeting first, whereas all those stakeholders relating to self-care space who are actually contributing one way or the other were brought together, and together they actually sat down and used the global framework to actually identify specific activities that they want to do, and identified the type of indicators they want to track. But at that first stage, there was no an MIE specialist in place to support them. So it was just that bringing people who are actually technical program officers together to, okay, these are the things we want to do, and these are the things we want to track. So at that level, they were able to actually bring out input level indicator as well as some level of output level indicator. But essentially, issue relating to outcome level indicator and impact were not what was done. And even as that, at the preliminary level, when you give the product of what was done, good job, to any MIE person, that fellow should be able to work more on it. And that was what happened. So at the second stage now, an MIE person comes in, and I happen to be that person, review what was done, good work, and build on it. And ask some questions to rephrase what was done, then go through some literature review, including the global reference sheet for self-care, including the WHO reference sheet, and including the national guideline itself.
Of course,
because it's the national guideline that produces the indicator.
Indicators.
So I came on board, review what was done, rephrase some of those things, and brought up suggestion relating to outcome level indicator and impact. Importantly, outcome. When you talk about outcome level indicator talks about the changes in terms of behavior, in terms of knowledge, unlike input and output. Input level indicator are just that what are the things that were contributed to make activity takes place. It might be financial, it might be training, it might be other resources. Whereas output relate to how many people were you able to reach out to. But when you reach out to somebody, it doesn't necessarily mean that that fellow, you've changed that fellow. It doesn't necessarily mean that the attitude, the knowledge of that fellow is being imparted positively. So that is an important aspect that I brought in outcome level indicators. This
sounds like a very detailed and rigorous process leading up to the production or development of the M&E plan. Congratulations and well done, sir. Okay, so let's talk about how effective this M&E plan has been in translating national policies for self-care into practice.
Okay, before we go into that, the original guideline hasn't an MIE plan. So that was why the national government just decided to develop an MIE plan to be a component of the guideline. The issue is that MIE, monitoring and evaluation, monitoring is, are we doing the right thing that we lay out to do in the guideline? That is what monitoring is, using a layman's language. Are we actually doing what we're supposed to be doing? That is what monitoring track. And evaluation tracks are effective. Have we been able to achieve the desired goals and objectives? That is evaluation. It's very important because, like I said earlier on, you need an MIE plan to be able to actually direct your actions, to be able to state, give feedback to stakeholder. This is where we are. Are we making progress? If we are not making progress, we need to go back to the drawing board. Are we achieving the desired target? If not, we need to go back to the drawing board. We need to re-strategize. That is why the MIE plan is very important. Not only is it about are we making progress, it also brings out the issue of documentation. You want to document, you want to have evidence of what is being done. And in your MIE plan, there's a section that actually describes how that is going to be done. By who.
So how effective has this been? How effective has it been?
Now, it's still in the teaching stage. Let me use that word. In the fact that it's a stand-alone document for now. It's yet to be incorporated into the self-care guideline. I'm hoping in the next round of review is going to be on. Now, it's been effective to the extent that one is been validated, and when stakeholder validate the document, it means you've gained their ownership. So one is been validated, and secondly, I want to state that we've been able to actually advocate the inclusion of all of those data elements into the routine data collection tool, HMIS tools. At least some has been accepted, which is a good thing for the team, for the self-care stakeholder. One important thing is that we've not been able to make more progress But the progress, which for me, I can actually state it anywhere, is the fact that, look, the team, we've been able to actually work together with all stakeholders to ensure that some data element, some indicator on self-care are now in the HMIS tools, which means you can actually get evidence to report on. And another progress is the fact that every stakeholder devote into it.
So you're even answering my next question. Yes, but it's amazing. Okay, amazing, sir. So let's just go on, more emphasis, although you're already touching on it. What would you say are the success stories and the self-care indicators on that the M&E plan captures? What are the indicators in the M&E plan, and how were these indicators developed?
Okay. Now, like I said, the indicators were developed based on some criteria. One, they have to actually address the area of intervention in the national guideline for self-care. All of those five area of five or six were actually form the basis for the identification of the indicators. Now, and the indicators has to...
Sorry to interrupt you, sir. For those viewers who do not know the indicators, the areas of focus, could you just kindly mention?
One of the areas is coordination and regulation. The second one is advocacy and finance. And we have supervision and monitoring. We also have supply of products and
demand generation.
Demand generations. So those are the areas that actually form the basis for identifying indicators. And secondly, you just don't identify indicators, you want to identify indicators that are measurable. You want to identify indicators that are cost effective, that you don't waste time on. That is usually related to cost effectiveness. You want to collect data on the indicators that are useful for program management. So those are some of the things that we have considered. And you have indicators that Nigeria as a country, can actually reflect on and be able to make contribution when we are talking globally. Take for instance that we have opportunity to participate in any form of conference, any workshop outside of Nigeria or even within the country. We have global related indicator on self-care where we should be able to actually talk to. So those are some of the factors that were taken into consideration. So some of those indicators we are talking about are global related indicators, and all others are the ones that are relevant to Nigeria as a country that were considered.
Okay, sir. So let's talk about the success stories. You mentioned earlier that some of the indicators are in the NHMIS. Could you kindly just highlight them? Okay,
we have an indicator on WASH. WASH relates to water sanitation, and is an aspect which is very fundamental, especially for pregnant women. Not only for pregnant women, for an individual, but we have been able to actually incorporate an indicator on WASH into the ANC register. Yes. So it means invariably that we want to address issue of infection control amongst pregnant women. When a woman is pregnant, they need to be overwhelmed with hygiene, so that she will not be infected, as well as the baby, unborn baby. So that's what we've been able to do that. We also have indicator relating to family planning, DNPSC, especially take-home number. Those is for the pregnant woman. Self-care is about doing it yourself after the initiation. So the quantities that the women will be able to actually use on their own was actually incorporated into the family planning register. Then for the labor and delivery, we have Mistroposol, which is for the control of PPH. Women can be trained to actually use that immediately after delivery to control for excess loss of blood. And we've been able to actually include IFAC, that is iron folic acid, into the register as well.
These are huge success stories and commendable success stories for self-care. So let's talk about the barriers. What would you say are the barriers that have been identified based on the current data? What barriers have been identified in translating other self-care policies into practice?
It's one thing to have a document, a guideline. It's another thing to be able to implement what we have.
Yes.
And at the implementation stage, you find out that, let me take an instance of the coordination. We've done a fantastic work at the national level. a fantastic work because stakeholders are well informed, they are well involved. But at the subnational level, even though we've been able to, the team has been able to actually go to like 26 or how many states?
24, including the FCT.
But not every state have a good understanding about what they're supposed to be doing. So it's a barrier in terms of we've not been able to translate what we intend to do into actual practice.
Yes.
Because the implementation doesn't take place only at state and national level. The state, the community, those are the places where actions are. So we need to actually do more to translate that into practice. There are other areas relating to knowledge, awareness, demand generation. Demand generation has not been very robust for now. So we still, even though there is an advocacy package, not all MDLs are actually aware of what self-care is. So what we're saying is that, okay, we should do more to actually meet with policymakers at that level in most of the MDLs and actually put them through what? Organize workshop for them, organize advocacy visit to visit them to explain what self-care is all about to them.
Thank you very much, Dr. Gbenga. So basically you're saying there's so much more work to be done, especially at subnational level, need for more advocacy, awareness and demand generation activities. Thank you so much. We are going to go on a short break right now, and when we come back, the Voices for Self-Care continues with From Policy to Practice Through Numbers, Data Management for Self-Care. We'll be right back. Welcome back. You're watching the Voices for Self-Care podcast, and we're talking about from policy to practice through numbers, data management for self-care. And I have in the studio with me a very important guest, Dr. Gbenga Ishola. He is a monitoring, evaluation, research and learning expert. And Dr. Gbenga has been really helpful talking about the monitoring evaluation plan. And right now we're going to talk about the significant gaps in self-care interventions captured in the M&E plan. What are the significant gaps captured there, and are there any opportunities for improvement?
Yeah, apparently there's no document that is 100% perfect. Yeah, one aspect that I would love to have seen, originally it was there, but during validation, during review and validation finalization, we were asked to actually expunge it, and that is an aspect related to learning agenda. What are the things you want to learn in the course of, you want to learn in the course of the implementation of the guideline? I remember us having like 3 or 4 learning agenda. That means because these are the topics to which we want to research on. We want to learn the outcome, how this thing works. Well, most likely because the stakeholders weren't very much interested in research, we were asked to actually remove it. But I'm very glad it's coming, it's resonating now.
Of course.
Because during the global conference that was held in Ethiopia, one area that was actually emphasized as important is learning agenda. So with this understanding, I'm sure by the time we're going to be reviewing the MIA plan, the team will go back to actually identify specific learning agenda. Other thing is that we might need to actually streamline the number of indicators as with time. We need to streamline them because there are those indicators that are routine database. That is, you can only collect data on them using the HMI stores in the health facility or community or at any service delivery point. But there are other indicators that are population-based and health facility-based. Those indicators you need to actually conduct survey, and they can be resourceful intensive. Resources intensive, it means you have to get money, you have to get personnel, you have to wait. Some of those, the data, you cannot get them not until after 5 years. Or 3 years or 2 years.
So you're saying that those indicators should be taken out, we should streamline them?
Not that we should take them out completely. We should be very mindful of the number of population-based data that we want to actually follow up as part of it. I think those are the things that, and one other thing is the fact that there's supposed to be, when you have an MIE plan, there's supposed to be a desk officer who is who has MIE knowledge, who has interest in MIE, because the essence of an MIE plan is to be able to give feedback this is where we are. It's for you to be able to guide us. So you have somebody to be able to work out, bring out data, use the data for data visualization, as well as use it to actually advise the directors as well as implementing partners. This is where we are.
Thank you very much, Dr. Gbenga. Profound recommendations and areas of improvement. Now let's talk about the expansion of self-care from SRMH into RAMCA. What are your thoughts on this, especially when it comes to monitoring and evaluation?
Well, I don't think we've set the basis. The first thing is that we have a plan for now that is sexual reproductive and maternal health, which was developed out of the guideline.
Yes.
Now, if the national guideline is expanded, the MIE plan will also needs to be expanded. Now, the component of the MIE plan that will be expanded will just be the indicators.
Okay.
Not all the level of indicators are still very relevant, but in terms of what indicators do we want to track now. So there might be indicators on nutrition that you might want to actually incorporate that are not already there.
Okay.
Yes. But I still am of the view that we have a good plan now. The MIE matrix is very elaborate. I will see us just reviewing it and rephrasing some of those indicators to capture relevant indicator and essential indicator related to RAMCA.
Okay.
Especially the adolescent component.
Especially the adolescent component, especially, yes, because I support that, because there's going to be, from my own opinion, I think there's going to be a lot of work to be done in advocating to the adolescents especially. So I'm going to ask you, what recommendations or considerations rather would you say or recommend for developing a comprehensive M&E plan that can effectively capture the broader scope of RAMCA?
Well, my recommendation is the fact that one, the development should be more participatory.
Okay.
One, very important, that if we're going to be reviewing the guideline and actually the MIE plan as a follow-up, as a part of it, at the point of the reviewing of the guideline, MIE people, MIE specialists should be part of the review. So in so doing, they should be able to actually track and identify specific indicators and data element that they might want to actually bring forth for the team to actually agree on. So it's important at the point of the design or the review of the guideline that the MIE guys are also there. One problem that has always been faced when you talk about program implementation, not only in Nigeria, is the fact that people think of our MIE last.
Oh, I see.
So even when you are employing yourself, you find out that people want to consider, hey, we need an MIE guy. It will be the
an
last
afterthought.
group of people
Yes.
that, yeah, it's as if they are just like that,
okay.
which is supposed not to be.
Okay.
So you want to bring them on board right from the revision of the expansion of the national guideline, and you want them to actually talk to the participant and ask questions that we actually help in actually reviewing the MIE plan, as well, especially the indicator matrix and the indicator plan.
Thank you very much, Dr. Gbenga. Apt recommendations. So my last question for you today is, let's talk about the community feedback, the role of community feedback in the development of the current M&E plan, and how this participatory approach, like you said, would be enhanced for the expanded RAMCA, to come.
Okay, community is a very broad concept, terminology. No, I don't want to look at community.
I'm speaking with an okay, yes.
I don't want to speak at community as community in physical form.
Okay.
I believe that is, if that is what you're thinking of, I'm not looking at community as a physical community.
Okay.
I'm going to be looking at community as it relates to this in terms of professional community.
In terms of
professional
community.
Yes,
professional community. Okay, yes.
When you have medical doctors, they come.
Of course, they have a community, yes.
Pharmacists also.
Of course.
Program level people also form their community.
Okay.
So I will look at it from that perspective.
Okay.
And the fact that I've talked about all user participatory approach, it means all of those small communities have a role to play in the development of the MIE or in the expansion of the MIE plan. Let me give an example. You have people that are into supply chain. They are a community on their own. they can actually bring their wealth of knowledge, what they will need into the MIE plan.
Okay.
You have those who are into advocacy. I'm sure you are into advocacy. We will bring it into the section where we're actually going to be developing, expanding what you've been done. You have people that are MIE specialists. You also want them to come. How do you want us to actually work across all of this intervention area? They will be also talking to them. And at the point, you have people, the MIE specialists, bringing all of our thoughts together into an expanded MIE plan.
Amazing. So in the end, it's still going to fall back to the M&E specialist, but of course you would need the community of different people in advocacy, in demand generation, all the thematic areas. Thank you so much, Dr. Gbenga. It has been such an interesting conversation with you. Do you have any last words you want to say, anything you want to say about moving self-care policies into practice from your own experience?
Thank you very much. I think Nigeria has been one of the forerunner of developing the guideline. And apart from a forerunner in developing the guideline, we are at the forefront of even developing an MIE plan for self-care. So with this understanding, I believe we should be much more proactive. Proactive not only to have those as just document, but proactive in saying that we put evidence into use, which is what MIE plan is all about. And we are much more committed to reporting our activities.
Thank you so much, Dr. Gbenga. I've had a very interesting conversation with you, and of course I'm going to always commend you. I commend the work you're doing and the work GSI has been doing in translating self-care policies into practice. Please keep up the good work. So to you, my esteemed viewers, many thanks for staying with us, many thanks for joining in, and if you have any questions, please do make sure to write it down at the comment section or send a message to rancoms@gmail.com. that is WRANCOMMS@gmail.com. I remain your host, Oyari, and I'll see you next time. Bye.
Thank you.